Well, welcome to the Aging Boomers. I'm your host, Frank Sampson, and of course on our show we discuss so many of the issues facing boomers, their parents, and what we know, of course, is an aging population. I want to remind everybody that today's show is sponsored by Senior Care Authority, a professional senior placement and elder care management organization that has a national network of advisors to help in determining the right path for senior living and receiving proper care. So whether it's in-home care, assisted living, residential, or memory care, get the necessary advice from a senior care advisor in your area by calling Senior Care Authority at 888-809-1231, or you could go directly to the website at www.seniorcareauthority.com. Again, I want to thank everybody for all their support and getting the word out to friends and family. Hopefully you'll continue to do that. Our listeners are growing. Many of you, of course, have just gone on to their iPhone or Android phone and downloaded the free app, the Aging Boomers app, which you can do. A lot of you have gone to iTunes, iHeartRadio, Spreaker, Stitcher, many of the other sites on the internet. Of course, you could also go to our website at theagingboomers.com. And I'm thrilled to introduce our guest today. Her name is Trisha Torrey. She is an author, speaker, and patient advocacy consultant, which we'll learn a little bit more about. With a background prior to her advocacy work in teaching and marketing, in 2009, Trisha founded advoconnection.com, a directory that helps patients and caregivers find patient advocates who can help them get the good health care they deserve. The advocates found in the directory are all members of the Alliance of Professional Health Advocates, an organization she founded in conjunction with AdvoConnection, which provides business support to private, professional, independent patient advocates. Trisha has written 6 books. 2 of her books, the You Bet Your Life series, helps patients and caregivers understand how to improve their outcomes when they access the healthcare system. Her other books, the Healthcare Advocate Career Series, support the business needs of private, independent patient advocates. Trisha, I just want to welcome you to the Aging Boomers. Thanks so much for joining us.
Thank you, Frank. This is a privilege. I've enjoyed getting to know you and what the work you're doing, and I'm happy to share what it is we're trying to do, too.
Great. So, I would like to just start out, I know we'll get into detail more about your organization, but tell us a little bit more about what a healthcare or patient advocate is, and kind of what's the background of what you would think would be a good advocate.
Well, a patient advocate is actually anyone who helps a patient anywhere in the healthcare system, from the time they start to experience odd symptoms right on through any kind of diagnosis and treatment they need, or then even into medical billing arena, where they start to get bills that they don't understand or seem high or don't seem to mesh with the insurance or Medicare or Medicaid they've got. Whatever that would be, anywhere in that gamut, a patient advocate's the person who jumps in to help them out. So there have been patient advocates around for hundreds of years. In some sources you'll find Florence Nightingale was actually the first person that the term patient advocate was assigned to, because she's famous for her nursing work. And so that's really a great foundation to start with. The situation we're in now, though, is that patient advocates are beginning to work in a more professional realm than they ever did. So it's no longer just about helping a spouse or a parent or your child or whatever it might be, someone who's in your life who you can help out. You can now access patient advocates in hospitals and insurance companies, and then private patient advocates, and those are the folks that I work with, are the folks who are independent. They have a practice like a lawyer would have a practice. And you can hire them like you would hire a lawyer to help you with a will or whatever it might be. You can hire a patient advocate to help you anywhere in the spectrum of health you might need. And there are differences among them, and there are differences in the ways they can help you. The profession of private advocacy has really only been around for maybe the last 5 or 6 years. So it's quite new.
So, there's a lot of different terms out there, thrown out there, and I want to hopefully clarify some of it up for our listeners. I mean, you have geriatric care managers.
Mm-hmm.
You and I met at a conference for the Society of Certified Senior Advisors. There's a lot of different terminology being thrown around out there. So where does the advocate kind of fit in to all of that?
Yes, well, the advocate fits in anywhere where healthcare is the major concern, where that's the primary concern. So we complement the work of everyone else who's out there. So a geriatric care manager, their expertise might be in housing, or their expertise might be in transitions, those kinds of things. They might call in a patient advocate, or a person would be better served by a patient advocate when the core problem is around healthcare and not necessarily around housing or some of the other issues. And the other thing is, too, patient advocates work with any age group. And so where a geriatric care manager might work only with older people, a patient advocate could get called in to work anywhere in the age spectrum at all.
Got it. And speaking of the healthcare system, let's talk a little bit about that. And, you've, my understanding, and you certainly can get into it, you don't come from the healthcare industry. You've gone through a lot of personal situations, I guess, that kind of led you into this. But from what you've seen through the years, how has the healthcare system changed from when boomers were younger to today, and how do you see it changing in the future? I'm sure that's a question that could last the entire show, but maybe,
we probably could.
Yeah, but maybe you could just give us your opinion.
You're a boomer. You're a boomer too, and so I think you're going to understand exactly what I say when I say to you, Marcus Welby has left the building. Any
Right.
of us who are over the age of maybe 55 or 60. Think back to Marcus Welby, who was the very paternalistic, all-knowing, almost omnipotent doctor on TV, and within an hour...
I never missed a show. Yeah.
And we loved it because it was such a feel-good show. I mean, there was always a problem, and he was always able to solve it. And that's kind of the experience so many of us had when we were younger. And not only that, most of us didn't really have huge healthcare challenges when we were younger. But if we did, we went to the doctor and they seemed to be taken care of. And somehow we didn't see a bill. We didn't have to worry about whether we were going to pay it. And we never questioned whether or not the doctor was right. If something didn't work right, we mostly thought it was because of us. Either we weren't doing something right, or because we weren't we weren't being treated. We were prescribed a drug and didn't take it the way we were supposed to. Whatever it was, we always kind of put it on our own shoulders for the reason it wasn't working. Well, time has shifted, and particularly in the 1970s when different kinds of HMOs and other kinds of systems started to arise, the shift slowly went from taking care of patients who needed it to making sure that whatever the doctor or facility, whatever it was, could make as much money as they could from the system. And by the year 2000, the early 2000s, is when we really began to see the shift. The difference was that most of us weren't aware of it. So if we were fairly healthy as younger people, all of a sudden we got into our 50s and maybe into our 60s and started to see problems we were having. And everybody else knew the system had changed, but we didn't. And so here we were accessing a system using the old rules for a system that had just evolved or maybe devolved to something we didn't recognize at all. And still wondering, why on earth aren't we getting what we need? There must be something wrong with us. And in fact, it's not what's wrong with us. We are the same people. What was true was that we are not at all prepared to face a healthcare system unless we've made a very thorough study of how to get what we need. And because the system is set up only to make money, and it's sad but true, not to say there aren't providers out there that want the best for us. They do want the best for us. But they are getting pressure from many other places to do their jobs in ways that they're very uncomfortable doing them. And it's patients who are paying the price.
You know, you hear all different opinions, especially with elections going on and primaries coming up and all of that. But it's said that in our country, in the U.S., that we still have the best health care in the world. Do you believe that?
I think we have the potential to get the best health care in the world. I think that the capabilities of the people who work within the system are there to provide it. Unfortunately, the system ties at least one hand behind their backs. And when I say the system, what I mean is the requirements of the system to make money mean that we aren't necessarily getting what we need. And because it's that way, not only are we not getting what we need in many, many cases, too many cases, but per capita, it's costing us twice as much as any other civilized country of the world. And it's coming right out of our pockets. Even if we don't see it going out, we're beginning to see it more now, of course, but if we don't see it going out, it doesn't mean it's not being spent. It's being assessed to us in higher premiums for insurance. Our employers are paying more for our insurance when we have an employer. And as taxpayers and Medicare, we're paying more and more. And so now we have the double whammy of not getting what we need and paying more for it.
So as far as cost goes, I mean, costs have definitely gone up. I mean, like you made a statement before, which is absolutely true. Years ago, we'd go in and get care, and we had insurance. Those of us that were insured, it's like you hardly ever saw a bill. It was pretty much, taken care of, or the cost was minimal. Now our premiums are very high. Maybe we're not, we're still seeing bills along with the premium. And is that what's kind of the catalyst for us asking a lot of questions where before we weren't?
Yes, absolutely. That's a great point, Frank, and I'll even enhance your point a little bit. The truth is, the system has not been working well now for over a decade, well over a decade. But we weren't really aware of it until it started costing us more money out of our pocket, where we saw the money being paid. So as long as premiums pretty much stayed the same, or no more money was being taken out of our paychecks for Medicare or whatever that might be, if we didn't have to pay for it, we didn't think we had to question it. But now when we're getting these bills and seeing what it's actually costing us for health care, and including all the changes they've talked about for Medicare coming up, now all of a sudden we're saying, well, wait a minute. You're asking me for all this money out of my pocket. I've never had to do that before. I need to begin paying attention. And now, too, we're hearing the term healthcare consumers, which I will tell you just drives me up a wall, because consumers, the idea of consumer means that you can research prices. If you're going to buy a car, you're a consumer. You can go online, you can go to the dealership, you can read magazines, whatever it is. You can learn about a car you might want to buy, the pros and the cons, the costs, what insurance might cost you, etc., for that car. That's when you're a consumer. But in healthcare, we don't have any of that. And so we aren't truly consumers, because we just have to take what we can get unless we learn some of these other, I hate to call them tricks of the trade, but that's actually what it is learning to be a smart patient and understanding what the constraints of the system are so you know how to get around them.
So what do you think either the biggest problem or some of the biggest problems are for baby boomers in facing this healthcare system?
Well, I'm going to give you somewhat of a flip answer, but it applies to every problem that all of us have, and that is that we don't know what we don't know. We just don't know what we don't know. And if we don't even know the questions to ask, then we can't get the right answers. So I'll give you a couple of examples. We don't know what we don't know. When we try to choose our health insurance for the next year during open enrollment or during Medicare open enrollment, when we choose it, we can't predict what's going to happen to us in the next year. And so it's almost asking us to have a crystal ball to try to choose our insurance. But we don't know what we don't know, and we also don't know how to predict what some of those things might be. And so if you then take that same example and move on to something like You've got symptoms, you go to your doctor says, okay, here's what I think you have, and this is what we're going to do about it. Well, what you haven't heard are what the other options are. And if you don't know what you don't know, then you can't ask the right questions about, well, what other options might there be, or what happens if I don't decide to be treated, or whatever those things are. And nobody's ever taught us to be smart enough to ask those questions. And so that's what the new shift is beginning to take responsibility for those kinds of things, trying to figure out what we don't know that we don't know, and then trying to get the answers for the questions.
So instead of boomers kind of learning how to swim by, just jumping in and learning, what other means do we have to make sure we're asking the right questions?
Well, there are a couple of different things we can do. One of the wonderful things about our generation of baby boomers is that we are the most educated group ever in the history of America at this point in history. I'm sure there are other groups behind us that might be more educated than we are, but anyone who was older than us as a body, they were not as well educated. And those of us who can take what we've learned in our lifetimes and then begin to search out either the right people or the right resources to help us figure those things out, that's what it is we need to do, and we have the wherewithal to do it. So there's some ways you can do that. You can get as much information from a doctor, perhaps, and then go look it up online. Now, the key there is that you've got to make sure you have credible resources. So, for instance, a doctor might say, I want you to take this drug. And you say, okay, let me look into that. And you go home and you look up that drug, and you think, oh, my gosh, this is the miracle drug. I'm going to take this. But what you didn't realize is that you were looking at the website that was put up by the drug company. It doesn't look that way, and you have to dig to figure that out. But it's very slick, and it's got lots of great information, but it's not necessarily very objective. And so if what you know is that website might not be very objective, then you know that you need to move on to something that would be more objective. And if you understand those rules, quote unquote, for finding objective websites, that's something that can help you. Finding resources, when I say that, I mean finding those resources online, certainly, but then finding people who know answers as well. And so for one thing, you look for a second opinion, and you make sure that you get that second opinion from a doctor that is totally unrelated to the first opinion doctor, in a different health system, maybe in a different city, even in a different state if it's something highly unusual. Because two doctors who are friends or who know each other, they're colleagues, they won't contradict each other, or typically they won't. I hate to use blanket statements. I'll say typically they won't contradict each other. And so what you don't know is that you need to get an opinion from someone else. And then finally, you can bring in a patient advocate. If it's a loved one and you feel as if they've got some of this expertise, well, okay, then give them a try first. You might find someone who's in a hospital or an insurance company, although those are not your best choices, and we can go into that in a minute. Private patient advocates only work for you, and you are their sole focus. And they do know the questions that need to be asked, and they do have the resources for getting you the answers they need. And their big thing is to support you in any decision you have to make going forward.
So do you think that we're prepared on what is to come with healthcare?
Prepared? No.
Yeah, prepared.
No, in no way are we prepared. Nobody's ever taught us to be smart patients. It's not a skill we ever used or ever learned to be used in later in life. And even if we had been taught to be smart patients when we were younger, nobody ever suspected that the health system would evolve to what it is. And so we're not prepared. And it's an education just by itself to learn to be a smart patient. And then it's an enhanced education to learn to be a smart patient with whatever it is you've got that's wrong with you.
But don't you think our generation, I say our generation, the boomer generation, is quite different than the silent generation where, our parents, our grandparents, when a doctor or a nurse told them something, they took that as fact and no questions asked.
And they still do.
Yeah, and they still do. But we've been raised more to ask why. And do you think that's the case with boomers in the healthcare system? Well,
yes and no. I think you're right that in general that's how we've been raised to question things. Certainly the Vietnam generation, we were questioning a whole lot back in the late 60s and into the 70s. There's no doubt about it. The problem is, and I don't know if you have ever been diagnosed with something really horrible, but the minute there is a bad diagnosis, our brains seem to just totally shut down with our regular capabilities. And I say this having been through it myself. The whole reason I do the work I do is because in 2004 I was diagnosed with terminal lymphoma and given just a few months to live. And it took me 3 months, but in 3 months, doing just a variety of things, and really because I was scared, not because I was smart. I started asking questions that weren't asked typically. I got a hold of my medical records and Googled the living daylights out of them. Never knew that you could Google Greek letters. Did you know that? In any case, when I went through that whole thing, I figured out that I had no lymphoma at all, and I've never had any form of treatment. And so the question at the end of it was, had I actually gone through any kind of treatment, and what was proposed was chemo and radiation that I was supposed to go through so I could buy myself an extra year. If I hadn't asked the questions I'd asked, then on the other end of it, if I'd gone through all that treatment, I would have survived it, obviously, because I was actually healthy to begin with. I didn't have lymphoma. So if I'd survived it with all of the problems that go along with chemo, on the other end of it, the doctors who were wrong, who had made mistakes, would have been heroes for doing the right thing. And that kind of sets the stage for how I got into the work I got into. But I have to tell you, it took me weeks on the front end, weeks from when I first heard the diagnosis, before I could actually even coherently ask a question. And in those weeks, they were sending me for tests, and the tests were coming back clear, and yet they were still insisting I start chemo and radiation. So what I'm telling you is that when somebody is first diagnosed, no matter how smart they are in every other aspect of their lives, no matter how much they question everything else in their lives, they typically don't seem to question what's going on in the healthcare system. And if the doctor is nice to them, they don't seem to question much at all.
So I'd like to talk a little bit about you have several books, but you have a book called You Bet Your Life, The 10 Mistakes Every Patient Makes. So a couple things. One, I certainly want you to share with our listeners, how they could get a copy of the book and learn more. But do you mind sharing maybe just a couple of those mistakes with us?
Well, sure. I'd be happy to share them, because I think what's also important to mention is the subtitle of the book, which is How to Fix Them to Get the Healthcare You Deserve. So the book is not just about making mistakes, and it certainly is not, the point of the book is not just to talk about the horrors of the healthcare system. I mean, in all of these years, we've been able to figure out what most of those are. But if you understand where there can be pitfalls, and then you understand how you can work around them, then you can certainly get better what you need. So one of the first mistake is thinking that healthcare is focused on you, the patient. And it's not. Healthcare is focused on making money. And so if you understand that, and you understand actually how insurance and reimbursements work, you can actually use that information to get what you need. Another one is not confirming a diagnosis. And you just heard my story. I was misdiagnosed in a huge way. Everyone who is told they need anything like surgery or chemo or a drug for the rest of their lives or whatever that bigger kind of treatment might need to be, they need to get a second opinion. And they need to get that, as I mentioned earlier, from somebody who is objective, who is not going to simply confirm what their friend or colleague has just said. Another one is thinking you've been told about all of your treatment options. And that almost never happens. And here's how you can test it. One of your treatment options is to not get treatment at all. And rarely will the doctor say, or you can choose to have no treatment at all. It's not that those alternate treatments might not have different kinds of consequences. They might. You might say, I don't want any treatment at all, and what you know is that will result in your death. So it could be that that is the only outcome from not being treated, but still it should be mentioned as one of your options. But typically, what we find is that treatments that will not make enough money for the provider's company, and when I say that, very few providers now are working on their own as independent doctors. Most of their practices have been bought up by hospitals in systems called ACOs, and that's not something that patients hear about, But if you ask your doctor, who are you working for now, chances are he or she is no longer working for him or herself. They're working for a hospital. And hospitals put pressures on them to provide X number of patients to get X number of treatments in any given month or year or period of time. Another mistake is thinking you're safe in the hands of the healthcare system. And so there is research. The first research that was ever done on this came out in 1998, and it said between 44 and 98,000 Americans died from medical errors every year. Now that research has been updated as of 2014, and the numbers are a minimum of 440,000 Americans are dying from getting the wrong treatment or from a medical error, a surgical error, or whatever it might be. And there is a list of errors that are included in that 440,000.
And that's what we know. And that's what we know about.
Yes, those are the ones we know about. And by the way, those are only in hospitals. And so if there's an error taking place in an exam room or at home, for instance, if you've been prescribed the wrong drug and you take the wrong drug and you don't get the treatment you need, you could eventually die. You may never be in the hospital, and that error might not have taken place there. It's really frightening. We
do hear that, unfortunately, we're running out of time here, but I could talk to you all day about this subject. But, we hear all the time, you need to be your own advocate. Well, I think what you're saying, you need to be your own advocate, and if you can't be, then get somebody who can be.
Yes, that's exactly right.
Right. So tell us how people can go to your site and learn more about finding an independent advocate. Tell us about that, and then and how they could get in touch with you if they needed to, and then we'll have to wrap it up.
Okay. Well, I have a couple of good resources. I think people will find that these are good resources. The book I was talking about, You Bet Your Life, The 10 Mistakes Every Patient Makes, that can be found in any bookstore, Amazon, Barnes & Noble. And if you Google just the name of the book, you can also find the website for the book, and the publishing company can sell it to you directly as well. So I think that can be helpful. If you're needing a patient advocate, or if you just want to explore the option of getting a patient advocate, we have a directory that is available to anyone. It's free to search, advoconnection.com. That's advoconnection.com. You just put in the zip code of the patient and an email address, and it'll come back to you. Oh, and you can check off the kinds of services you think you need, and it'll come back to you with a list of everyone who's in your area or in your state who can help you out. If people are looking for me, everypatientsadvocate.com. Easy enough, everypatientsadvocate.com. Trisha Torrey. You can also Google my name. It's Trisha, Trisha Torrey. You'll come up with all of those. Any of the email addresses at any of those, come to me, no matter what that email address is. So if someone has questions, I will help them as best I can. Sometimes the best thing I can do is send them to another professional. Sometimes I can send them links to articles or resources. But this is what I do for a living, and I love it, and I know people are being helped because I hear from them, and we want to help your listeners too.
Trisha Torrey, thank you so much for joining us, and we'll have to have you back for sure. Lots to talk about, and some great information. Thanks for joining us on the Aging Boomers. Really appreciate it.
Thank you so much, Frank.
Great. I want to thank everybody for listening in. Again, please share our site, our information with friends and family, people anywhere in the world. So thanks again for joining us. Please be safe out there, and we'll talk to you all soon.